Good morning friends, welcome back to my YouTube channel. Please don't forget to subscribe my channel and also please give your valuable comments. Okay, now today we will discuss about Ekadasha Rupa, Shadrupa and Trirupa and its relevance in the clinical practice. See, Ekadasha Rupa, when it is explained, there are certain mild presentation of immunocompromised states. Now in the Ekadasha Rupa, the Charaka explained 11 symptoms. Okay, Swarabeda is there, Jwara is there, Shula, Daha, Sankocha, Atisara, Amsha Parshva Santapa, then Pitta Vamana and Rakta Vamana, etc. If you see these symptoms, it is not that all the symptoms are present in all the patient. So what he is telling is, any of these symptoms may be present. Maybe singly may be present, 2 may be present, 3 may be present, and if it is very severe, there's a different issue, all may be also present. Now, how many symptoms out of these listed symptoms will be there? That depends upon the immune capacity of that particular patient. Sometimes there may be only one symptom, maybe 2 symptoms. So now, patient may have all the symptoms or may have only one symptom or 2 symptoms in the beginning. With the adding up of the symptoms, alter onwards as the disease progresses. As the disease become more and more severe, maybe all the symptoms may be there. Okay, now so here system is not specific, but almost all the systems are affected. If you look into the symptoms, Swarabeda means respiratory system is affected, Jwara means general body immune system is get affected, Shula means again maybe abdominal pain or GIT is affected, Daha means fluid system is get affected, Sankocha means maybe the nervous system or muscle system is get affected, Atisara again GIT is affected, Amsha Parshva Santapa again the Jwara or the temperature regulatory system, then Pitta Vamana, again Rakta Vamana, etc. Hemopoietic system. So many systems are affected. Okay, there is affliction of the many symptoms, many systems. So meanwhile, there is a still restoration of the immune system. So immune system is able to resist and produce multiple symptoms. And immune system is able to produce a multiple symptom means immune system is producing some of the symptoms after fighting with the pathogen means immune system is strong. Immune system is strong. Okay, so this is called as mild presentation. This is called as mild presentation. The same mild presentation has been referred as Ekadasha Rupa. Okay, all the symptoms may be also present if the disease is very much progressive, and in the beginning there may be 1 or 2 symptoms. As the time passes, there may be adding of many symptoms. It does not mean that in the beginning itself all the symptoms are there. Come to the moderate presentation. So this is called as Shadrupa. Okay, so there are certain groups of the symptoms in an immunocompromised state where symptoms are more specific to particular system. Now, if you look into the Shadrupas, Annadvesha, there is a loss of appetite, then Jwara, fever of unknown origin, Shwasa, there is a dyspnea, breathlessness, respiratory distress, etc. Kasa, recurrent cough, maybe because of viral infections and all, or allergies, etc. Shonita Darshana, hemoptysis, and then Swarabeda, change in the voice due to the laryngeal involvement, or some compression of the nerves, etc. This is a moderate presentation. Now, severe presentation. Now, as the disease becomes more and more severe, when I say as the person is going towards the immunocompromised state, now its immunity is going down. Okay, there is no immunity, just like PM case. There is no immunity at all. Now, when the immunity is 1% and the disease strength is 99%, it is always the disease which takes the upper hand. Okay, immunity is only 10% of immunity is remaining, and 90% of the disease has been progressed. Pathogen is progressed. Then it's the pathogen which takes the upper hand. It's not the immune system. So there will be immunosuppression, and there is no production of more and more symptoms. See, in the Ekadasha Rupa, we have got many symptoms. Even in Shadrupa also, there is many symptoms. That means your immune system is almost equally fighting with the pathogen. Now, this is a stage severe presentation where immunity is very weak, and your immune system is not at all fighting with the pathogen, and it is always the presentation of the pathogen only which is coming up. So they are very specific in a patient of immunocompromised patient. See, severe presentation, 3 Rupa Rajayakshma, only 3 symptoms will be there. Only 3 symptoms. As the patient becomes more and more immunocompromised, the number of symptoms will go into decrease as the immunity is very weak. So patient will have emaciated body with only few major symptoms. What is that? Jwara. Okay, another one is Kasa, another one is Rakta Vamana. Only 3 symptoms will be there because he is severely immunocompromised. He is not able to produce, his immune system itself not able to produce the symptoms. It is not able to fight because symptoms are produced because of the fight between the immune system and the pathogen. Now our immune system is not in a position to fight at all. It's completely surrendered. So only minimum symptoms will be there. Just generalized symptoms will be there, like jwara. The patient may develop all the symptoms or may one symptom depending upon the immune status of the person. Here also in the severe, 3 symptoms are explained. Jwara, Raktavamana and as well as Kasa. Patient may develop any one symptom, or sometimes he may develop all the 3 symptoms. Okay, most probably jwara will be there, recurrent attacks of fever. Now, in majority there will be involvement of the respiratory tract and gastrointestinal tract, which are more prone to recurrent infection. Now they have mentioned 3 symptoms. One is jwara. Jwara is a generalized condition. In any of the infections it will be there. Number 2, Kasa, which suggests maybe towards the respiratory system, because usually the recurrent respiratory tract infections are common in the respiratory system. Therefore, Kasa has been mentioned. And another is G8 infections. So, Raktavamana is explained. So, symptoms explained by the different authors differ as each other owing to prevalence of particular infections during that time may be lived. If you look into Vagbhata, Charaka and Sushruta, the Ekadasha, Shadrapa and Three Rupas, so there is slight differences there. Okay, it may be depending upon the infections which is very prevalent in their time, maybe. Now, immunocompromised condition is a state where the patient is vulnerable to any kind of disease, especially the infective disorders. As the body immune system is depressed, the mild exposure of the patient to the pathogen may also acquire some sort of infection very rapidly. So meanwhile, the repeated infections leads to hampering down of the body growth due to nutritional and vitamin and as well as micro mineral deficiency and vice versa. As the metabolism is affected, the production of the all body tissues, including the antibody, immune cells, RBC, WBC, T cell, B cell, everything is get affected. So body will fulfill the parameters of growth so now when this is happening, the body is not in a position to fulfill the parameters of the growth like height, weight, anthropometric measures with the subsequent stunting of the psychological growth. So patient loses the appetite. This is called constitutional symptoms. Loss of weight, loss of appetite, loss of interest. They are called constitutional symptoms. Now, this presence of these constitutional symptoms are very, very typical of immunocompromised state. Okay, patient loses the appetite, loss of interest in all the routine activities with the development of easy fatigability, nirutsaha. Now, body is prone to viral, bacterial, parasitic, fungal infections and even the mycobacterium tuberculosis or leprae-like infections, which directly affects the body immune system, because once the immunocompromisation is there, so anything can come and attack. Okay, so Rajayakshma is not only tuberculosis as generally believed or generally taught to the students. Rather, it is a pool of immunocompromised, that means a pool of disorders. Pool of disorder means it is an immunocompromised state. From there, anything can develop. Anything can develop. Okay? Rather, it is a pool which gives to a number of infective disorders, nutritional disorders, deficiency disorders, metabolic disorders out of it.